Just want to introduce my department. We are always actively trying to recruit research students from all over the world. So please scan the QR code and feel free to contact us. So today, I think I'll just jump straight into it. So today I would like to just share a bit about how research can actually affect policy changes and practice changes. Yeah, so my area of interest is looking at nursing workforce development and healthcare redesign. So one of my key areas of development is the nursing advanced practice nurses in Singapore. So what exactly is an advanced practice nurse? According to the International Council of Nurses, advanced practice nurses are educationally prepared to practice out and above more than what a registered nurse can do. So in Singapore, like mentioned, all advanced practice nurses in Singapore are masters prepared and they have an expanded scope of practice. And we've developed this role, I think today we can say it's 20 years ago we first developed this role and now we have about 347 practicing advanced practice nurses in Singapore. So just want to take you through how APN development is like in Singapore. I won't bore you with the details, but I wanted to say that we have come a long way since 2003, 20 years ago, where we just started to introduce the role of an advanced practice nurse in Singapore. And in about a short span of over about 11 years, we have redesign the curriculum to make sure that it always constantly evolving and meeting the needs of our nation. So I want to just share with you that in Singapore, because it's an aging population, just like many other countries right around the world, we are not able to expand because also with declining birth rates, we are seeing less and less medical students being trained. We are also seeing less and less nurses being trained within our universities. So then our Ministry of Health and also our Ministry of Manpower is trying to see how we can creatively expand certain roles in the healthcare workforce to make sure that healthcare remains sustainable and also not too expensive. And that's why they thought that the role of the advanced practice nurse may come in handy in helping to augment and support the healthcare system. Okay, so this is the number of advanced practice nurses certifications we have. At the latest numbers that we have now is 347, but as of last year we have about 360 something advanced practice nurses. Yeah, but before we wanted to really expand the role of an advanced practice nurse in Singapore, we had to do some kind of a background study. So I led this nationwide study mapping out the exact practice patterns of advanced practice nurses in Singapore. And we realized that across the 5 domains of practice, of advanced practice nursing practice, our advanced practice nurses are practicing more in direct comprehensive care, supporting the system and also education, much less in leadership and also research. So we wanted to also kind of test out the acceptance of the role of advanced practice nurses in Singapore, and we wanted to see what is the impact like, the perceived impact of increasing the number of advanced practice nurses in Singapore. We realized that if you look at the light blue color, it is very, very positively seen. Yeah. The introduction of more advanced practice nurses or expanding the role of advanced practice nurses is seen to have a positive impact on safety, timeliness, effectiveness, efficiency, equity, patient-centeredness, and of course, reduce healthcare costs. And we wanted to also not just expand the role without having consensus from the advanced practice nurses. We had to ask them for their readiness. Are you ready to do more than what you are actually doing now? And if you see, the ones in blue is the current amount of time they spend in the 5 domains of practice. And most of them wish that they could do more. Most of them wish, you can see across all 5 domains, they all wish to have their roles expanded, they wish to do much more within the domain of their practice. And with that, all this information that we've gathered, this is just a bit of information that I'm sharing with you, but we did a more detailed report for our Ministry of Health to let them know that this is what's happening in the nation. And this is the nationwide study that we did in 2017, and this really, provided the basis to establish the collaborative prescribing program in Singapore. So this is what happens in Singapore now. We have advanced practice nurses that not just have expanded nursing practice, they are also able to have prescribing authority and prescribe medications. And it's all because we informed our policymakers that, hey, they can do it, they have a positive impact on healthcare, and they want to do it. Yeah. Another example that I'm going to share is the implementation of the role of the advanced practice nurse in the community. So with our Ministry of Health, there's a huge move towards not keeping our patients in the hospital, but moving the patients essentially into the community, nearer to home. And not only that, we prioritize value over quality, and we are moving towards making sure that our population has health and not just providing health care. So with that in mind, we wanted to look at this particular population, which is patients with atrial fibrillation. So atrial fibrillation is a heart rhythm disorder. I have a very close cardiologist friend who tells me that, if you live long enough, you'll get atrial fibrillation because it's really an old person disease. Our heart works as a battery, and as we age, that battery quality also, kind of declines. So if you think that it's just an old person kind of disease, you are wrong. There are more and more evidence now showing that people who are younger, specifically from the age of 40 to 69 years old, if your BMI, body mass index, increases for every 5 minutes of increase in your BMI, you have a 37% risk of atrial fibrillation. And therefore, we wanted to revisit how we provide care for patients with atrial fibrillation. And if you can see, it's a very messy situation initially, where patients of different care acuity needs were all going into the hospital, and that is not good. We wanted to tidy things up and make sure that people who are really sick are going to the hospital and seeing the cardiologist. Patients who are not so sick, more stable, they shall be managed in the community, and in this case, in Singapore, we call it the polyclinic. So these are polyclinics in Singapore. We have medical centers that are situated within the neighborhoods. You can see this is a very typical setup of a polyclinic that is situated in a residential area. So you can see there's a school here, and all these high rises here are public housing. And you will see that by 2030, we aim to have 32 polyclinics across our very tiny nation. Yeah. But now at the moment we have 22 polyclinics. So in the polyclinics is where people go for subsidized healthcare, primary health, and for their primary health care needs. And so this is generally a summary of what the role of an advanced practice nurse is. They are able to clinically diagnose the patient, review the patient, and prescribe medications and treatments to the patient. So what we did was to implement this process, but before we implement, we wanted to engage our stakeholders. The stakeholders, most important stakeholder is the patient. Do they have general acceptance of having a nurse take care of them instead of their cardiologist? It's something that is still quite scary for patients who have heart diseases, because usually patients with atrial fibrillation, they go to their cardiologist in the specialist clinic in the hospital. So now we wanted to ask them if they are comfortable to have the advanced practice nurse see them. And we realized from this study that I conducted that there is really quite less than optimal acceptance of that role, because it was not properly explained to them. And we realized that, when we explain the role properly to them, and when they do have that experience with that advanced practice nurse, they realize that they enjoy the consultation much more than a doctor, because the nurse sits down and really talks to them more and longer than with a physician. Okay, so this is the clinic setup. The advanced practice nurse leads the clinic. The family physician will sit nearby just to confirm certain treatment plans and also provide some supervisory comments. And then it is supported by computerized decision support, and also we have a web-based education to help the patient to live with their atrial fibrillation condition. We have very close collaboration with the hospitals because very specialized investigations like the 3D echography, the 12-lead stress treadmill test can't be done in the polyclinic, so we will have to still refer them back to the hospital for further investigations. So I'd just like to show you how the clinic looks like. This was, if you could, sorry sir, if you could help me click on the pictures, just click on the first picture and the second picture. There should be a play. If you scroll up at the picture, yeah. If you could go to presentation mode.